And back to our coverage of the COVID-19 pandemic, we're focusing now on the welfare of frontline health workers. And joining us to discuss this is the Vice President, Nigerian Association of Resident Doctors, Arome Chris. He joins us from Abuja. Good to have you join us, Dr. Chris. In the first wave of this pandemic, there were concerns about how health workers and health facilities are overstretched. Help us understand the situation now in this second wave.
Thank you for having me, and Happy New Year to our viewers. Well, this second wave, from what we are seeing, is worse than the first wave. And the health facilities is being overstretched because while we are trying to combat the COVID-19 infection, we also have other things like malaria, hypertension, diabetes. And you know, of course, with the comorbidities, the mortality will also increase. And the truth is, our members also are not even encouraged. Some of them are depressed because of the burden of the work. You can see that most of the hospitals are understaffed. You see fewer doctors doing the work of many doctors. And when you are stressed out, when there is burnout, you lose your guide. You can easily become infected. And once a doctor is infected, you put the families at risk. You put the general public at risk, because the doctor-patient ratio in this country is like 1 to 4,400. And this is one of the major reasons why our members in Taraba State are on strike. You know, we try to have a no strike agenda in this regime because we want to change the perspective of Nigerians towards us. And we try as much as possible to prevent the strike from going
If I may just quickly,
but of course,
if I may quickly jump in there, Dr. Chris, I'm sorry to interrupt you, but I want to ask you, because a lot of Nigerians still do not believe that there is anything such as coronavirus. We've seen some sort of lackadaisical attitude in terms of using the face mask and just observing safety protocols. Talk to us about how this is impacting on your work as health workers every day. What is the impact of this?
It's impacting us a lot. It's impacting us a lot, and from the look of things, it's going towards a catastrophe. In fact, it's even, we are even trying to see how we can get the government to try and enact a law that will make the use of face masks compulsory, mostly in the hospital. You see some government top men coming up and saying that they don't believe in the pandemic. By so doing, you are increasing the risks the health workers face. And of course, you know that the hallmark of a functional health system should be patient safety. And patient safety is directly proportional to the safety of the healthcare provider. So once the healthcare provider is not safe, more people will be infected. So yes, the use of the face masks is no longer being in place. You see people, you go to supermarket, there is no sanitizers. People are not washing their hands.
I just again want to quickly jump in. I'm sorry I keep interrupting you because it's because of our time. This is one thing a lot of people do not know, that our attitude also impacts negatively or positively on your work. What areas are you looking at now if your job is to be made easier? What can we do as a people, and what should government do critically if your job is to be made easier?
Number one, the government should try and provide more PPEs. Number two, they should try and enact policies that should make it compulsory for patients and their relatives to wear face masks in the hospital and outside the hospital. Number three, they should employ more hands to reduce the stress and the burnout on the doctors. And moreover, number four, they should compensate the health workers very well. Because when you are not well compensated, the depression is there. And when you are depressed, you lose your guide. And when you lose your guide, you become infected. And when you are infected, you infect many others. That is it.
Dr. Chris, we cannot thank you and your colleagues enough for the great work you're doing on behalf of over 200 million Nigerians. Thank you so much, and thank you for talking to TVC News.
Thank you, ma'am.